presenting your long case, your ability to synthesize and prioritize information is critical. As an advanced trainee or consultant, you must not only gather all the relevant facts, but also connect them in a coherent narrative that tells a flowing story. Begin with a strong, concise introduction, ideally delivered within 20 to 30 seconds, that captures the essence of the case. In this introduction, highlight the patient's main problem, any complications that have emerged, and the impact on the patient and their family. Include key elements such as the primary complaint or presenting symptoms and any relevant medical risk factors or social context that influence the case. A well-delivered introduction immediately signals to the examiners that you have a solid grasp of the situation and have begun to synthesize the available information. Vary your tone for emphasis when mentioning critical points, demonstrating both clarity and confidence. After completing the physical examination, move on to developing an assessment summary that wraps up your findings. This summary should recapitulate the key points from both the history and the physical exam, while connecting the dots between individual data points to build a comprehensive clinical picture. It should highlight any complications, risk factors, or contextual factors that are relevant to the patient's current state. Often, your introduction can serve as the foundation for this summary, though it must be refined to include new insights from your physical findings. The goal is to provide the examiners with a clear understanding of your thought process, even before you formally present your problem list. Throughout your presentation, it is essential to integrate and prioritize the information. Think through the data as you gather it and link related points together, providing concise commentary to explain why a specific piece of information is significant and how it connects to other aspects of the case. Organize the information logically so that the examiners can follow your clinical reasoning, even before you formally present the problem list. For example, if the patient's primary complaint is refractory angina, briefly note how related factors, such as dyslipidemia or diabetes, compound the situation and influence the overall prognosis. Practice your introduction until you can confidently deliver it within 20 to 30 seconds, ensuring it captures the main problem, its complications, and the relevant context. As you gather new information during the exam, make mental or written notes of how each point relates to the overall picture. This habit allows you to naturally integrate these details into your narrative. Both your introduction and your assessment summary should be concise and clear, avoiding unnecessary detail while ensuring that critical connections are explained. When you synthesize the patient's reported narrative with your clinical findings, you create a robust picture of their condition. Begin by documenting the patient's main complaint as they describe it, then transition into a detailed exploration of each identified problem using your structured approach. Use your clinical judgment to probe further into issues that the patient might not have recognized as significant. For instance, while the patient might report chronic fatigue as their primary concern, your evaluation might reveal that the fatigue is secondary to an underlying endocrine or cardiac issue. Clearly explain how these additional problems interrelate with the patient's initial report and why they are critical for both prognosis and management. In summary, your long case presentation should demonstrate a systematic approach to synthesizing and prioritizing information. Start with a concise introduction that captures the main problem and relevant context. Then follow with an assessment summary that integrates the findings from the history and physical examination, ensuring your narrative logically connects all the key data points. With practice, this method will not only help you excel in the exam, but also strengthen your overall clinical reasoning and patient care in your future practice.